All right, so let's talk about a couple of subjects that come up a lot in physical therapy. Um, One is the root cause versus symptom thing, um, and see it a lot. You see a lot of videos online published about that, and it is important, right? Because there is a lot of symptom treatment and management in physical therapy that is necessary at times, but also isn't just the focus. However, I want to talk today about what the root cause is, right? What it can mean. And then also, when you're saying something is a root cause, is that really the root cause? So let's dive in, like examples. Many times people talk about if there's something going on in your arm, we always clear the neck, right? Because that could be causing pain in your arm or amplifying pain in your arm. And then we say, oh, the root cause is your neck, right? However, why did the neck get that way as well? So that's where I was talking about, like, root cause. Sure, your neck is a problem, but why is your neck a problem now? So I think a lot of PTs go, oh, I'll go to the neck, and then we do those treatments to the neck and not to the arm. Yes, we do treatments to the neck. We might do treatments to the arm to facilitate that. However, we also got to understand, why did their neck get like that? What happened? What are they doing? Are they doing something on a consistent basis that would cause their neck to do that? Are they overusing certain muscles, or are their muscles not working enough, right? And so we've got to understand that. Or are they in a position that they don't realize that they're like, look, you're in that position, it's going to cause something in your neck and it's going to cause your arm to hurt. So when we do that, now there are tests we can do um, to do that. Example, you could do some traction on the neck, you could open it up, you could do some manual therapy and say, oh yeah, you worked on my neck and it's better. Okay, well, let's get you in a position now where a muscles hopefully won't tighten up and you won't cause that symptom again or cause that pain. I think a lot of times you see on these videos where people are also like, oh, stop treating those things, stop treating the symptoms. That's just a symptom. That's a pain. Symptom management is something that can help patients. It's not the end, right? It's a beginning. And when I see people online saying, stop just treating the symptoms. Yeah, I agree. We don't want to just treat the symptoms, but the symptoms are something that we need to have go away in order for things to be better. So I would say, when you're treating, be careful that you're not just needling things all the time and sticking needles in it. Know why you're doing something and what. So what is important when it comes to the root cause, right, and symptom is having a systematic approach to your patients, right, to search out these things, find out why they're getting what they're getting, where is it really coming from. Because many times people will come in and say, my back hurts, and the back pain is a symptom. It's not the cause. Now, it's what they feel, what hurts them, right? And so we have to address that. But that's not, the back pain is coming because of something else. Something else is happening that they're doing, or something is going on that's causing that back pain. Or in an instance, they have hip pain and it may be coming from their back, but why is their back causing that hip pain? What is happening at that back? So that, having a systematic approach where we clear different areas, we also look at how patients are moving, what they're doing, taking their history in so that we understand what they're doing, what's happening, and not just go, I'm going to stick some needles in that thing because I have these needles in front of me, or I got this tool and I'm going to rub it on them all day long. I'm going to throw this tape on them because I know how to tape. We've got to understand what it's going to do. We also want to alleviate symptoms sometimes to get people to move better, because if that symptom is there, that pain changes the way people move. And so if we can reduce pain, get people to move more normally, then the pain won't be there. So I caution you when it comes to that having this systematic approach, right, to looking at your patient, having an intentionality in when you're examining them, and not just going, oh, I'm skipping those symptoms and I'm going to go to this root cause because the symptoms are bogus. No, the symptoms are still something, but you have to understand that they're symptoms. You have to understand that maybe something else is causing that, right? The thing I hate the most when I get patients is when they come in and tell me that certain treatments are the only thing that gets them better, but they keep coming back. They keep coming back. So that doesn't really get them better, but it does take away that symptom. It does take away the pain, but we didn't get at the reason why it is happening. And that's what I tell my patients is, it'll keep coming back because we're not addressing why it's happening. We're addressing the pain and that source of pain, but we're not addressing why this happens. And so having a systematic approach and talking them through that will help people not coming back and seeking a treatment I will do a more on this. We'll have some evidence-based information when it comes to systematic approaches. And again, none of them are perfect. I'm going to tell you, none of these systematic approaches are perfect. And again, when I talked previously about evidence-based practice, you'll get a lot of clinicians saying, in my years of experience and me, because I'm so awesome, I am going to tell you how to do this. Is okay, because I think people have learned a lot, but understand too that there are limitations and that their context may not be the same as your context. However, their systems and their approaches may actually be very good systems and approaches to help you think through a problem and not just do this treatment or stick this needle in them because this course told me last week that if that hurts, throw a needle in it and see what happens. I think it's, again, understanding why you're doing it, what the purpose is, what we would like to see. The last thing is, when you do treat people, you always want to ask yourself, what are they going to do if they get better, worse, or they stay the same, right? What are you going to do? What are you going to do? And hopefully it's not more of the same for all those three things. There should be 3 different ways to approach those, and we'll talk about that later. In our next video, we'll talk about some suggestions on what am I going to do with these 3 things. Okay? Comment below, and I'll have a new video soon.